Hi, my name is Adetoun Alli-Adams, clinical counselor and oncology counselor. And today I would like to address how the feelings of guilt or burden towards loved ones manifest in cancer patients. Cancer diagnosis can profoundly affect not just patients, but also their loved ones. Many patients struggle with feelings of guilt or perceive themselves as a burden to their families. And these emotions can take both overt and subtle forms. Addressing these feelings is crucial for the patient's mental health and emotional well-being, as well as the overall family dynamic. These feelings of guilt can manifest in forms such as emotional withdrawal, hypersensitivity, financial concerns, incidences of blame, fear, and comparison. A cancer patient under the care of a loved one may begin to feel as though they are imposing on their lives and become emotionally aloof or distant. You might notice that they speak less or give vague or short answers. To them, by saying less, they are burdening you less, and in a bid to be selfless, they end up isolating themselves. Patients may also feel guilty as a reaction to their helplessness. Not being able to help with basic household tasks or even personal hygiene can manifest as hypersensitivity to independence, with patients lashing out or even outrightly refusing help. Due to the costly nature of cancer treatments, the financial burden usually falls on the patient, especially in instances where insurance coverage or social support falls short. Patients may express concern that their illness is draining family resources, sometimes to the point of refusing necessary care. More often than not, patients question past behaviors or lifestyle choices as reasons for their illness. For example, smokers with lung cancer or individuals with a strong family history of cancer may feel responsible for their own diagnosis, complicating their feelings of guilt. As with many chronic or terminal illnesses, cancer causes undesirable shifts in family roles, such as a child taking on caregiving responsibilities or a spouse neglecting their career or health to provide care. Finally, seeing the toll the illness takes on others, patients may compare themselves unfavorably to healthier family members or friends, feeling useless or worthless because they no longer seem to contribute meaningfully to their relationships or the household. So to address these feelings, I typically advise a number of things. First, open and honest communication. Creating a safe space where patients and loved ones can share their feelings without fear of judgment, without misunderstanding or dismissal is fundamental. Depending on the severity of the situation and the family dynamics, family counseling sessions or guided discussions with the oncology counselors are effective ways to help patients express their feelings and concerns, while family members can affirm their willingness to help and provide reassurance. Regular family check-ins can also clarify misunderstandings, ensuring that the caregiving dynamic is sustainable. Secondly, restoring a sense of autonomy is vital for mitigating feelings of being a burden. By encouraging patients to participate in decision-making, even for minor matters, such as meal planning, scheduling medical appointments, or wiping down a surface, we can help reinforce their agency and mitigate feelings of helplessness. And it doesn't stop there. Many financial institutions and healthcare providers offer programs to alleviate the economic stress associated with cancer treatments. They typically connect patients and families with social workers, financial counselors, or cancer-specific charities that can address monetary concerns. They also guide transparent discussions about budgeting within the family that have been shown to foster a shared sense of control over financial planning. Furthermore, therapy provides an avenue for patients to process their emotions without fear of judgment. Cognitive behavioral therapy, CBT, has been proven to help patients reframe irrational thoughts about guilt or blame, while mindfulness-based stress reduction, MBSR, techniques can assist in coping with negative emotions. Peer support groups also allow patients to connect with others facing similar challenges, reminding them that they are not alone and that their feelings are not alien. Patients should be reminded that accepting help is not a sign of weakness, but an opportunity to deepen connections with loved ones. On the flip side, caregivers should be encouraged to express their emotional experiences, creating mutual empathy. As an oncology counselor, I help guide this process, ensuring conversations remain constructive. Cancer care should not rest on a single individual. By building a varied and dependable support system of family, friends, neighbors, or professional caregivers, responsibilities can be distributed evenly, thus bringing a sense of relief to patients, knowing their care does not solely rely on one overburdened person. Misinformation or misunderstanding about cancer and its etiology can exacerbate feelings of self-blame. Oncology counselors and medical teams play a critical role by educating patients on complex interplay of genetics, of environmental and lifestyle factors that contribute to cancer. Acknowledging the patient's resilience and contributions, even in small ways, can shift their focus from guilt to self-worth. Complimenting their bravery during treatment or gratitude for their role in fostering family bonds can uplift their spirits. Creating moments of normalcy, like celebrating milestones or achievements, reinforces their importance within the family dynamics. For patients grappling with existential guilt or broader why me questions, spiritual counseling may offer varying levels of comfort. Exploring spiritual beliefs, practicing gratitude, or engaging in meaningful rituals can provide solace and perspective. It is pertinent to acknowledge caregivers and how feelings of guilt can stem from patients observing caregivers. While acknowledging that being a caregiver is a burden of love, we must also provide them with adequate support. This can come in the forms of respite care, counseling, regular check-ins, among others. Empowering caregivers to maintain their well-being ensures a healthier relationship dynamic. In conclusion, feelings of guilt or burden are natural responses for cancer patients navigating the complex challenges of their diagnosis. These emotions, however, can be mitigated through open communication, education, empowerment, a collaborative care approach. By addressing these feelings compassionately and holistically, patients can redirect their energy towards healing and fostering positive connections with loved ones, while families can strengthen their resilience and unity in the face of adversity. My name is Adetoun Alli-Adams. I am a clinical counselor and oncology counselor. I have a special interest in working with cancer patients who are struggling with psychological aspects of cancer, because I feel this is an aspect that is usually ignored, especially in West African communities. You can find my Instagram, LinkedIn, and TikTok at Adetoun Alli-Adams, or my website at adeadamstherapy.com. I have just spent the day filming with MindFriend. Stay tuned for our coming content. Thank you.